Okay, this video is a book review. The name of the book is Precision Without Wisdom. Big Greek name here. Anastasios Papadonikolas, MD, PhD. He's an orthopedic surgeon. Here's the picture, the cover of the book, and it's a picture of the statue of David. What he was talking about with regard to the statue of David was Michelangelo's technique of starting out with the general outline. And Michelangelo used to say, the angel is in the rock and he simply sets it free. But it's sort of an iterative process whereby he gradually feels out how he wants it to be and makes little small adjustments one at a time. And he's saying that's how you have to be with development of surgical technology. It's not going to come, fresh out of the womb, so to speak, all ready to go. And you have to accept that fact. You have to develop the technology, to refine it, to test it, figure out what it's truly indicated for and what it doesn't work as well for and how you can improve it. Okay, so he's an orthopedic surgeon. He specializes in upper extremity surgery, things like shoulder replacements and whatnot, at an academic university. He does research on surgical implant devices. And he goes through sort of the history of orthopedic surgery with development of things like the hip implant by Charnley, the K-wires for internal fixation, things like the Ilyazarov fixator for the lower extremity, things like that. So he talks about orthopedic history. The guy knows a lot. And then what else? He then talks about how if you really want to improve surgical techniques, you have to track outcomes, but very few places do. There's not a single hospital I'm aware of ever in my life that tracks outcomes. Sometimes for an individual research study they'll do, but he talked about some famous doctors who recommended what was called the end result approach to medicine, to track all outcomes for every case done. And he says the guys got fired. Nobody wants that. And I'll tell you why they don't want that. They don't want that, for example, in internal medicine. Because you cure 100% of patients with a low-fat vegan diet. Drugs could never compete with a low-fat vegan diet. You cure most, coronary arteries. You cure 100% of coronary arteries. You cure most hypertension and type 2 diabetes if you get to it early enough, before the pancreas is destroyed, before the arteries are destroyed. So it will never, conventional medicine will never, ever, ever allow tracking outcomes, because low-fat vegan diet would just take over. We would return to Kempner's diet for a lot of things. Not for everything, but for a lot of things. And he feels that, research surgeons must be given more time to do research, but they're not. So what he's basically complaining about is pretty much everywhere in the Western world, the hospitals are on a tighter budget. Reimbursements have declined compared to the golden days of medicine in the 1980s. My dad was a doctor. He made tons of money. Like triple what doctors on average get paid today. A doctor can still make a lot of money, but it ain't like the old days. In the old days, it was easy to make tons of money. Nowadays, it's challenging. Anyways, what that also means, though, is the hospitals are on a tighter budget. They might have been happy. I remember when I was a resident, all the attendings had 1 day a week for research. Okay, there's no way you're considering yourself very, very privileged if you get 1 day a month for research nowadays. What did he talk about? He said real innovations, they don't come from committees and they seldom come from the big name hospitals. He says they usually come from medical maverick individuals who just get an idea and want to develop it. And they often are in, really bumfuck locations. Okay, a good example would be like Dr. McDougall. Dr. McDougall, trained in some Wayne State, in Detroit, Michigan, some place nobody's ever heard of. Then he does an internship out in Hawaii. Nobody's ever heard of that. He didn't come from Harvard. He didn't come from Stanford or an Ivy League place. And what I'm trying to say is that's where the truth usually comes from. Getting out to Hawaii, he saw all the differences between the Hawaiians, the Japanese, other Asians, and the Americans. Okay, you got a useful comparison there. It's often those big useful comparisons through epidemiology or a different system that enable, dramatic insights. He also said that a lot of early prototypes that are promising get discarded. They're not allowed to develop because they fail initially. But he says you got to give them time because it's not clear with an invention initially what are going to be its best long-term outcomes. And he talked all about hip replacements, how metal on metal didn't work, but it seemed good at first. A lot of that. I kind of liked ortho because I had considered going into ortho, but in the end I thought ortho was a little bit too brain dead. It's sort of like bone broke, must fix. But what I liked about ortho is orthopedic surgeon guys tend to be a lot of fun. They tend to be like athletes. I had grown up hanging around with athletes all the time. Athletes are fun. They're always cracking jokes. They're kind of self-confident. We're laughing. The other reason why orthopedic surgery is fun as a doctor is most of your patients, they're doing okay. They just have a fracture, and you got to fix the fracture or fix the arthritis of the hip replacement, knee replacement. If they have, like I remember when I was on my orthopedic, I did a surgical internship, and my orthopedic attending used to say, if Mrs. Jones has a problem with her sodium, call the internist. I don't manage sodium. I manage hip replacements. So we would all laugh and be laughing and joking around, making rounds. Okay, now in comparison with general surgery, if you're on general surgery, you got a couple of patients in the ICU and hypotensive and septic shock, all kinds of disasters. You can't be joking around. When Mr. Jones is dying in the ICU, you can't be joking around. So what I'm trying to say is surgery was always stressed out. General surgery is always stressed out and uptight. You can't joke. I didn't find it that much fun, whereas ortho was way more fun. But the intellectual aspect of ortho, implanted, it's like carpentry, really. So I didn't find it too intellectually interesting. An orthopedic conference will be, discussing 10 different types of fractures. Bone broke. And the old joke was all orthopedic classifications are the same. Mildly busted, moderately busted, badly busted, okay, for the fracture patterns. Is it comminuted, et cetera, et cetera. Does the fracture extend into the joint intra-articular, et cetera, et cetera. Okay, so what else did he have to say? What he basically said is that research and innovation in all Western hospitals is stagnating because the doctors aren't given enough time to do research and innovate, okay? And they're just pressure, go faster, make more money, generate more billing codes, productivity. That's pretty much how it is in almost all fields in Western medicine. He briefly talked about artificial intelligence, and he says basically there are no, like he said, in technology, you got companies known for innovation, like Apple computers or something, for example. He says in medicine, there are no places really known for innovation because everybody's just trying to be like the Red Queen, run faster and faster to stay in the same place with their budgets. So almost nobody's doing any significant research. There's always little BS sort of phony research, and there's a bunch of bogus papers written. He also lamented that the medical literature is so full of crappy papers that if you want to study a subject, it takes a lot of time to sort through what papers are real versus what are just corporate nonsense. And he thinks artificial intelligence could be a benefit in that context, that it can more quickly get to the useful information. But in my experience, AI can help you find good papers, but a lot of it is nonsense. And AI seeks consensus. It doesn't seek truth. It doesn't know how to recognize truth. So AI is it leans towards supporting the corporate BS. And what I've seen is corporations, they will flood a topic with bogus papers so that it becomes very hard to find the true good papers, especially like the old papers on topics like, let's say, soy, that tells you what a disaster it is. And then there's all these modern fake papers saying, oh, it's wonderful. So it's hard to figure out the truth. So that was sort of the bottom line. Stuff I already know. He phrased it pretty well. The book was about 100 pages. I read it in an hour walking on a treadmill, but the reason I could read it so fast was it was really about a 25 page book that he just made it into 100 pages, a big double-spaced print, because he wanted it to be considered a book rather than an essay. So it was pretty easy to read fast. So anyways, there it is.